Imagine a system designed to support workers suddenly turning against them, leaving many without the safety net they once relied on. That's exactly what's unfolding in Victoria, where mental health compensation claims are being rejected at twice the rate they were before sweeping reforms were introduced. But here's where it gets controversial. While the government insists these changes are necessary to stabilize the WorkCover scheme, critics argue they're pushing injured workers into financial ruin. And this is the part most people miss. Many of the rejected claims involve stress and burnout, now deemed usual occupational risks under the new rules. Let's unpack the numbers, the politics, and the human cost of this policy shift. Between July 2022 and June 2023, 70% of mental health injury claims were approved under the old system. Fast forward to the 13 months after the reforms took effect, April 2024 to April 2025, and the rejection rate skyrocketed to 61%, with only 33% of claims accepted. Even claims filed before the reforms but assessed afterward saw a 58% rejection rate. These figures reveal a stark reversal in how mental health injuries are being evaluated. Why the sudden change? The government blames a $1.3 billion financial shortfall in the WorkCover scheme since 2020, labeling it fundamentally broken. To fix this, they hiked employer premiums by 42% and overhauled eligibility criteria. One major tweak? A stricter definition of mental injury, now requiring proof of significant behavioral, cognitive, or psychological dysfunction, or a medical diagnosis. But the most contentious rule bars compensation for stress or burnout linked to usual workplace events. Instead, affected workers get 13 weeks of provisional payments, a far cry from long-term support. The impact isn't just financial. Consider the long tail of claims, those stretching past 130 weeks. Under the new rules, 71% of these cases were terminated in just 1 year, compared to 46% under the old system. This means thousands of workers lost weekly benefits, often at a time when they're most vulnerable. Luke Hilakari of the Victorian Trades Hall Council calls this a deliberate move to cut support for injured workers, warning of evictions and unemployment as consequences. Their misery is due to his embarrassing lack of leadership, he says, referring to former WorkSafe Minister Danny Pearson. The government defends the changes, claiming they'll improve return-to-work rates and reduce long-term dependency. A new agency, Return to Work Victoria, was funded with $50 million to help injured workers recover. Yet critics, like opposition finance spokeswoman Bridget Valance, argue the reforms are a tax on jobs, with premiums now costing businesses over $5 billion annually, the highest in Australia. So who's right? Is this a necessary correction to a broken system or a cruel abandonment of workers in crisis? WorkSafe acknowledges the reforms need time to fully materialize, but for those already affected, the wait for clarity comes at a steep cost. As an independent review looms in 2027, one question remains. Will these changes save the scheme or sacrifice the very people it was created to protect? We'd love to hear your thoughts. Do you think the government is striking the right balance, or has it gone too far? Share your perspective in the comments below.